New research shows an alarming increase in the number of younger adults dying from rectal cancer. It's the second leading cause of cancer deaths in the U.S., and 1 in 5 cases happen in patients under 55. Doctors warn it could become the #1 cause of cancer deaths in younger adults over the next 10 years. NBC News medical reporter Erika Edwards joins us now with more on this. Erika, good morning. I think one of the startling things here, as I said before the break, was, this is a real wake-up call for millennials, like younger people who probably are not often thinking about cancer or cancer screenings. Some doctors have called this increase in these deaths among younger adults a medical crisis. Tell us about what we are seeing in terms of these numbers and why we're seeing these higher rates among millennials.
Yeah, good morning, Savannah. This is an alarming trend. Researchers look back at death certificate data dating back to 1999, finding that the rates of rectal cancer are rising up to 3 times faster than colon cancer among people in their late 30s and early 40s, especially among Hispanic adults. And if this keeps up, as you said, rectal cancer could be the #1 cause of cancer death in adults under age 50 within the next decade. Now, experts don't know why we're seeing this increase right now. These patients generally don't have a family history of the disease, and now there's a scramble to try to figure out whether there is an environmental factor behind this trend, Savannah.
Erika, walk us through the symptoms of rectal cancer. What should somebody be paying attention to? And maybe some things that are sort of specific, if possible, to rectal cancer, because I know so many things can kind of get confusing about what it could be exactly, and when someone should get screened for it.
Yeah, some of the symptoms can be pretty vague, right? Fatigue, bloating, abdominal pain. But there are some other pretty specific symptoms that should not be ignored. And this is when we have to throw the ick factor out the window. Okay, Savannah, let's talk about it. Unexplained bright red blood after a bowel movement, or a feeling like you still need to go after a trip to the bathroom. Any unusual changes in bowel habits really should be addressed by a doctor immediately, Savannah.
Erika, rectal cancer is curable if it's found early, similar to colon cancer. What are the treatment options for patients?
Yeah, that's why it's so important to really monitor for those symptoms. The treatment for rectal cancer can be pretty intense, however. Surgery, radiation, chemotherapy, immunotherapies in some cases. All of these might impact a person's bladder, bowel, even sexual functioning. Savannah.
All right. Erika, thank you very much. Important reporting.
We thank you for watching, and remember, stay updated on breaking news and top stories on the NBC News app or watch live on our YouTube channel.